ICD-10 Origins. In this video, we will talk about how ICD-10 was formed. In 1983, the International Statistical Institute adopted the first version, also known as the International List of Causes of Death. In 1948, WHO took control of the International Classification of Diseases, ICD, with the primary goal of monitoring and aiding in the eradication of diseases across distinct populations. The sixth revision had recently been released at the time. Subsequently, ICD-7 and ICD-8 were published by WHO in 1957 and 1968, respectively. The International Classification of Diseases, ninth revision, clinical modification, or ICD-9-CM, was developed by the USA, and shortly after, ICD-9 was published in 1979. Surgical procedures and other elements required to classify the requirements of hospitals were also incorporated into the development of ICD-9-CM. But ICD-9-CM was a restrictive system with a limited ability to add codes to stay up with modern healthcare, despite being updated annually by CMS and the NCHS. After decades of development, CMS and NCHS finally adopted ICD-10 and modified it to form ICD-10-CM, the International Classification of Diseases, 10th revision, clinical modification. The codes for inpatient procedures were included in the International Classification of Diseases, 10th revision, procedure coding system, ICD-10 PCS, which was created in 1995 by CMS and 3M Health Information Systems. These codes were specifically designed for recording procedures only in hospital inpatient healthcare settings. ICD-10 Origins.